Hi, everybody. Today we are going to talk about OEP. We are basically saying goodbye to AEP. I'm sure a lot of you are saying, thank goodness it's over, but we do have OEP coming up, so we want to talk about that. Josh and I are here to answer any questions that you've got. So feel free to unmute yourself and ask any questions, whatever you need. We want to be here to help you. So I'm going to start my screen here. Okay. So can everybody see that? Or Mike, can you see that? Just shake your head if you can see it. Okay. Okay, good. So like I said, we're saying goodbye to AEP and hello to OEP. I hope that you all had an amazing AEP. I know that we were a little crazy here at the office, and that's always nice when it's crazy and busy. That's what AEP is all about. And so sometimes I'm a little sad when it's over, and then there's some relief, because there's not so many people that are coming in and out of the office, and you miss that. But you are glad that it's over and that you've been able to help people and do all of the good things that we do here during AEP. So I'm just going to tell you, I stole this from Advocate. They had a webinar the other day, and Josh was nice enough to send me the deck. But this was a slide that they talked about, and I wanted to definitely add this here because our agents make a difference because you are different. I feel like that we do the right thing at the right time for all of the right reasons. And I just wanted to take a minute and let you know that we feel that way. Rarely do we have any complaints or any compliance concerns. And that is amazing to have so many people out there. And, there's a lot of you out in the field, and to have all of that and to not have anything going on. So we are just so proud of you as agents. We know that you're out there trying to do the right thing and for everybody, and we are just so proud of you for that. Just don't want you to ever forget how important you are because, I've used the word demystify, but you just help during a stressful process of choosing a health plan by putting just a local friendly face on buying coverage. And you offer the knowledge that you know and the expertise that sometimes is really hard for somebody out in the public to get elsewhere. So I can't tell you how many times in our office, my office is real close to Erica and real close to Heather, and I will hear somebody walk out, or they're walking them to the door, and they'll say, I dreaded this so bad. I hated to come in and think about this because this is so hard, but you have made this so easy. And I just appreciate you. And they just thank them. And I text them all the time and tell them how wonderful that is, that they're helping the people that they help. And I know that sometimes we get frustrated with them because they're calling in the middle of the night or they're calling early in the morning. But just remember that you're doing such a wonderful job in helping them pick out a plan that they need to be in. But all of these things that you're doing leads to great member retention rates. And you have to remember that because during the rest of the year, when January starts, that's one of your main goals is retention for all of these people that you've written. And it's going to help you grow your book of business. It helps your community, and you become that trusted Medicare advisor. That was always my goal when I was an agent, was to be that person that when the word Medicare came up in my community, that I was the person that they thought about. So, hey, Beverly. You want to join? Okay. So Beverly walked in the office.
Beverly, you got to wave and let's see you. You got to see that.
I know you got
Hey.
to at least stick your head in here, they said.
Yeah. Hey guys, I want to say something. So I've seen all the reports of like complaints and things like that. And that slide that she showed first, like the reputation that y'all have as agents is really good. And that can't be said across the whole country because people are in it for the wrong reasons. But you all genuinely in stats, no, people may lie, but numbers don't lie. You know what I'm saying? So, and it shows that y'all are doing the right thing. So we're so grateful for everything.
We are. I can't thank you enough for all of that. Um, So like I said, what the webinar is today is about OEP because that is what's coming up. So a lot of people wonder, well, when is OEP, especially if you're a newer agent? And you're going to hear the word OEP probably in two instances. So we're going to talk about those two. There is an annual OEP that runs from January 1st through March 31st, which is coming up. And we're going to talk about what you can do during that time. But the SEP that you're going to use during this time is OEP. Then there's also an individual OEP. So those two things, you're going to hear the word OEP, but they are two different things because there is people out there that have an individual OEP, and it's the first 3 months of an enrollment in Medicare A and B. And that SEP is OEP new. And I think sometimes I know as an agent, I would see that on the SCPs and I would think, what is OEP new? I don't know what that is. But this is for new Medicare beneficiaries who are enrolled in a MA or MAPD plan during their IEP or ICEP. So I'm going to give you an example. If I'm getting Part A and B, and I have a start date of April 1st, well, I come to you and I enroll in an MAPD plan in March for an April 1st effective date. I now individually have an OEP window in effect for April, May, and June. So I can now make one change to that plan that I've chosen. I can also use that OEP election period to drop that MAPD and go back to original Medicare and pick up a drug plan. So I think sometimes we forget about that OEP because we just think, okay, I've written you and you're just going to be happy and we're going to move forward. And sometimes that's not always the case. Somebody may feel like, okay, I've gone to my doctor and all of a sudden they've told me this plan I've signed up for, they're not going to take. So, that they've got those 3 months that they can change their plan. So just don't forget about that. That's an important OEP. But mainly today, what we're going to talk about is the annual OEP that runs from January 1st to March 31st, because that's the one that's coming up. So if a beneficiary is enrolled in a Medicare Advantage plan, so an MA or a MAPD, they'll have a one-time opportunity to do several things. They can switch to a different Medicare Advantage plan. Their effective date will be the first of the month following their OEP election. So in other words, if I come to you in January and I say, okay, I feel like I need to make a change from this Medicare Advantage plan that I'm in, that coverage will go into effect February 1st. If I come to you in February and I want to make that change, that plan will go into effect March 1st. Okay, so see how that works? It's going to go into effect the next month after you change them. Another thing that people can do during OEP is they can drop their Medicare Advantage plan and return to original Medicare, which is their plan A and B. So if they're not happy, if they made a choice in a Medicare Advantage plan and they decide that's not what they want to do, they can actually drop it and return to original Medicare during this OEP time. And then they can sign up for a standalone drug plan. But that's only if they return to original Medicare. But they do have that opportunity to get that drug plan if they need it. Josh, I'm just going to let you jump in whenever you want to, okay?
Oh, you're just doing so good. It's so elegant. with that tree behind you, it's all you're just keep going.
So OEP is a chance for members to test drive their new MA or MAPD plan. That's kind of how we want to look at it, is we're just letting them test drive it and see if it works out for them. So I like that phrase. I got that from Advocate, and I think that that's a good phrase and a good way to look at that. But what is OEP good for you as well? OEP is good for retention and referrals. I don't want you to look at OEP as an extension of AEP. OEP is for retention. So this is a time where you want to make sure your members are happy. If they want to switch plans, you want to make sure that they do it with you and not another agent that reaches out to them. So making calls to your members during this time is always time well spent, because you want to make sure that they're happy. If they're not happy, you sure don't want them reaching out to somebody else that can make this change for them. And also reaching out to them during this time, you can ask for referrals. And we, I think, sometimes forget about that, but our book of business is free advertising, because word of mouth is free advertising. So just keep that in mind when you're talking to your book of business, to always ask for referrals.
And Lisa, I want to say something on that. I know a lot of times people are afraid to, or at least in my experience, people are like, I don't want to just get on the phone and start calling everybody again, and because there may be an issue, and I don't want there to be an issue, but I would say don't look at it like that. Look at it as an opportunity, because one, you could fix an issue, you could help them. Y'all know between Lisa and everybody else and Advocate and all this stuff, we can help solve issues. We all have experience with carriers and things like that. But the opportunity is, obviously, if they need to go back to that plan, they stay with you and you move them back. Or, like she's talking about, the referrals, it is the best time, because especially folks that the good plans out there, that you put somebody on, if somebody's got 4,000 dental and this and that, well, they need to tell folks, because a lot of people didn't make a move. There's a lot of people out there still on their same old plan.
That's right. So who can use the OEP? It's individuals with an MA or MAPD as of January 1st. So if they have an MA, Medicare Advantage plan, or a Medicare Advantage plan with a prescription drugs, okay, they can make a change during OEP. The people that can't use OEP are people that are enrolled in Original Medicare only, prescription drug plan enrollees, or Medicare supplement enrollees. So if I'm going into January and I have made the mistake of getting with one of you, an agent, to make a choice during OEP, and all I've got is Original Medicare because I didn't get with you when I should have, we cannot do anything for you during OEP. If all you have is Original Medicare, we can't do anything during OEP. If all you have or all you're wanting to do is change your prescription drug plan, we can't do that either during OEP. That's not a time to change PDPs. Medicare supplement enrollees, they're not someone that can use this OEP either. Okay.
But I want to make a statement here. This is all what we're talking about, but so if you meet somebody that has Original Medicare, there's a lot of areas now that where you may not be able to use the OEP, but there's a C-SNP in that plan in that area. So there's opportunity year round for that plan. So just remember things like that. Okay.
Yeah. So if somebody does come to you, in January and that's all they've got is Original Medicare, you still do have some answers for them. You've got the C-SNP if they qualify for it. You just kind of have to dig into that. But they can't use the OEP because they're not changing from an MA to an MAPD. But that's great information, Josh.
Okay, Lisa.
Yes.
Hey, I have a question. If there's a situation with a client, lady, I guess going to be a potential client, but she was on a plan. She was a QMB something plus, and she's switched to a Slim LB or something. But anyway, her plan, she would no longer qualify for that particular plan, which ended in December, but she didn't register for anything. So she automatically in January, she's going to be on original Medicare and she'll be without a prescription drug plan. Is that correct?
That's correct. Does she qualify possibly for the chronic SNP?
I'm sure she would, but she had just got her Slim LB status, and I think in October. But she didn't. That plan ended. I thought she thought she could stay on that other plan, and she can't. And she didn't get a new plan.
Okay. Usually when you have to come off of a plan like that, they give her 6 months.
Oh, okay.
But now if it ended in December, then, she may have lost it sooner than she thought. Because, the company is giving her 6 months. So, but check and see if maybe she qualifies for the chronic SNP. Because that might be helpful. And then if that's not the best plan that she needs to be in, you could change her during OEP. We don't, that isn't always the greatest thing to do, but it would be able to at least get her some coverage. Josh, any
So you're
thoughts
saying
there?
you're saying that the plan that she's on right now, this would be the last month for the plan, but you saying she still can get another MA plan starting in January.
Well, if she qualifies for the SNP, the chronic
Okay.
SNP,
Okay.
then you would
Okay.
be able to write her because that's a year-round SEP.
Okay.
So you would be able to put her in that.
I tell you what, do this for me. I'm going to put my number in the chat, and I want to talk to you later on today, if possible, and let's brainstorm and see if there's something we can do. Okay.
Okay. All right. Thank you.
Here's my
Yeah,
number right here that we can
there's a
figure out.
lot of different avenues that kind of can go into that. We can brainstorm and probably get her something. And it's, there's also an SEP that she's changed status. So we need to look at that as well. So there's several things that we can do.
Okay.
Off limits. Some activities are off limits for beneficiaries during OEP. They cannot switch from original Medicare to Medicare Advantage. So that's what we were just talking about. If all they have is that red, white, and blue card during OEP, they can't decide to choose a Medicare Advantage plan. That's not what OEP is for. They can't use it to enroll in a PDP if all they had was original Medicare January 1st, and they cannot switch from PDP to PDP. So that one is always a little confusing. Sometimes people think, well, if I can switch them from an MAPD to an MAPD, then surely I can switch their PDP to PDP. But you cannot do that during OEP. What about all those little acronyms? That's insane. So the bottom line is the annual OEP is for beneficiaries who are currently on a Medicare Advantage plan as of January 1st. And one thing I want you to know is this can be members who used the AEP election period or not. So don't get that confused. Just because maybe they didn't make a change during AEP doesn't mean that it has anything to do with OEP. Okay, they can, if they have an MAPD, they can change during OEP. Okay, just remember it is a one-time election, and it can only be used once a year. And the effective date will be the first of the following month of the enrollment. So just remember those things. And if they are not on an MA or MAPD, they cannot use OEP. I know we keep saying the same thing over and over, but we just try to put it in your brains, I guess. OEP is not the Wild West. We want to remember that OEP is not an extension of AEP. So please don't use it that way. Sometimes you'll hear people say, well, I can get to them during OEP. So I'm not going to deal with them in AEP, and I'll just deal with them in OEP. Well, this is not an extension of that. You need to be taking care of your members at the right time. This is just it's just another avenue if you find members that are not happy with what they have. Okay. And agents cannot try to poach business or reclaim members that enrolled with another agent. Okay. So we don't want you out there realizing, okay, so Betty was Erica's member, but during AEP, Beverly changed her. So Erica's mad. So during OEP, she goes and rewrites a different plan for that person so that she gets that agent, that member back, and she's their AOR. So we don't need to be doing that during OEP either. Okay, so just try to
that
keep
person
that
would
in
have just
mind.
been, excuse me, because that person would have just been putting them on another plan to get them back, and not the best plan that they may have been put on already.
That's right.
But like I said, yeah, just keep in touch with your members, and that's less likely to happen in general. That's the big key there.
It is definitely. And one thing, I was going to say something. I've forgotten what I was going to say. I'll remember it in a minute. Anyway, so there are some non-permitted activities during OEP that agents have to remember. You cannot send out unsolicited materials referencing the OEP or advertising the ability to switch plans. So we can't go out and put flyers out everywhere telling people that OEP is here and you're able to change and switch plans during this time. You cannot advertise that. Okay. You cannot engage or promote agent activities to target the OEP as an opportunity to make further sales. So we talked a little bit about that already. This isn't an extension of AEP, so just keep that in mind. And you cannot call or contact former enrollees who selected a new plan during AEP. So there's a lot of non-permitted activities here that we just have to keep in mind. We just cannot, I guess, advertise OEP is the best word. Now, if you have someone that calls you and you happen to be talking to your member, maybe they called for something else or you reached out to them and they make a comment that they are not happy with their plan, then you absolutely can tell them about OEP. There is nothing wrong with that. And we can go out. I know that sometimes we go out to doctors' offices and we will remind them of the OEP time so that we're not putting up flyers. We're not doing anything like that. We're just letting them know that it's here in case they have people that come in and are not happy with their plans so that they're aware of that time. The other big thing, and I don't think that we have a lot of this happening, but just make sure that if you notice that somebody dropped off of your book because they changed during AEP, just remember you are not permitted to call or contact that former enrollee. Okay, so that is not permitted during OEP.
Hey, Lisa.
Uh-huh.
So, but you have those people that you have their addresses, they're in your book of business. So this would be a great time, like I said, once again, to do those refer a friend flyers, because you may even hit somebody that may have left, but you're not calling them, but you can send out letters and things like that. And I'm glad you spoke on that. I was going to tell you what you already said about the education part of it. That's huge because we work with a lot of doctors, our whole group and all. And so it's good to get that out there. We have a agency owner who has a big event going on down in Mobile, and he did a live interview. And during the live interview, somebody asked him, well, he did not bring up OEP because he can't, but they asked him so he could talk about it. So just look for those cues look for opportunities because you can still get it out there without getting it out there, if you know what I mean. So
That's right. Yeah, so there's ways that you can definitely reference it, but just make sure that you're not sending out any flyers. That can be the biggest deal.
yeah.
So do we have any questions about OEP or anything that you can do during OEP? Any questions about that? Or just any questions in general that Josh and I could answer for you while you got us here? Anybody? Well, that's good. That means that we did a good job, Josh. So please keep in mind that I am always here. Make sure that you have saved my number in your phone and you can reach out to me at any time. I can help you. If I don't know the answer to a question, we will get it. But that is what I am here for. So I just want to make sure that you know that and you're aware of that and that you do not feel like you cannot call me, because that is actually my job, is to help you as agents. So please make sure that you've got that information and you can reach out to me at any time. Josh is available as well.
Yep.
I think he put his number in the chat. And he is always a wealth of information. So he can help as well. So if you feel comfortable, calling Josh all the time or calling me all the time, either is fine. We love to hear from you. That is what we're here for. And we just want to make sure that you feel supported for sure.
The key to everything, y'all, is reaching out to your book of business for retention, and you're going to see a lot of sales come your way through just how well you've helped people and them getting the word out. So just trust us on that. So, but hey, Merry Christmas, everybody.
I think we're kind of losing you a little bit, Josh.
I said Merry Christmas.
Yes, yes. So we do want to say Merry Christmas to all of you. Thank you so much for joining today. And if you were waiting on the ACA part at 9:30, I said this earlier, but you might have missed it. Heather had an emergency this morning, so she is not able to join us. What she said she would do was this afternoon she would record her part of the webinar, and she will get it sent out to you. So just watch for that. But thank you so much for joining us. We look forward to seeing you all in the new year, and we will start our webinars back up in January. But Merry Christmas, everybody. Y'all have a good day.
Merry Christmas.